Well, let's dive straight in and look at the very disturbing story of lobotomy, as you'll see, where part of the frontal cortex in particular is ablated through forms of surgery. And let's have a look at the birth of lobotomy, because I think in many respects this demonstrates how speculative psychiatry could be. Lobotomy as a practice was the product of this guy's mind. Igaz Moniz, he is Portuguese professor of neurology in Lisbon. He became a politician and had a very, very long and distinguished career. But in 1935 he was attending an international congress of neurology in London. And at that conference he hears Carlisle Jacobson and John Fulton from Yale talking about the emotional changes that they had witnessed in chimpanzees that they'd been carrying out experiments upon. In this case, ablating, that is, more or less destroying their frontal lobes. And what they'd noticed when they did this was chimpanzees, which I'm sure you all know can be pretty aggressive, were made completely and utterly placid. That ablating their frontal lobes affected an enormous change in their behaviour. So, of course, Moniz thinks, well, if you can do that to chimps, you can do it to humans. And he returns to Lisbon, and between November 1935 and February 1936, he lines up 20 patients. Now, notice Moniz himself is actually a neurologist. He's not a surgeon. He's not someone specialising in undertaking operations under anaesthetic. So he does have to recruit a friendly surgeon to undertake these operations. And without any qualms, they get 20 patients and they more or less carry out this operation that you can see portrayed in a rather anodyne way. Opening up the side of the skull, going into the side of the skull, and resecting part of the frontal lobes using the tools that we can see here. And according to Moniz, and of course we've seen this before, this idea of cured. According to Moniz, 7 of these patients were cured. 7 had their symptoms ameliorated, and with 6 there was no change. Now this seems to be like a real success story. Notice how I don't know how you'd random controlled trial for lobotomy. It would strike me to be fairly impossible, but notice I put cured and ameliorated there because what cured means is it's a very, very slippery term, as we saw earlier with Henry Cotton. Having used normal surgical implements, Moniz goes on to develop the leucotome, which was a specific tool for undertaking this form of lobotomy. And on the back of this, in 1949, wins the Nobel Prize in Physiology or Medicine. And we can see from the citation why he won the prize. The localization of certain psychic functions in the brain. It's long been known that the frontal lobes are of great importance for higher cerebral activity, especially in regards to the emotions. The destruction of the frontal lobes by bullet wounds or brain tumours led to certain typical changes of personality, etc., etc., etc. And of course, yes, they did have a very wide history of understanding that certain traumas to the brain could result in a change in personality or a change in the emotional disposition of a person. They had all of that experience from, in particular, World War I, when millions of soldiers died, but even more millions of them were wounded. And some of those were head wounds, shots to the skull that didn't end up in killing people, but might have ended up wiping out bits of the brain. And of course, on top of that, they go back to that well-known story of Phineas Gage, the railway worker in the USA. I'm sure you've seen the picture, who had a spike in an industrial accident pretty much go through his frontal lobes, and significantly changed his personality in the process, having survived from that. We have all of that tradition, but remember, it's a kind of post hoc justification. Moniz gets the idea from the story of the chimps, so we have a chimp-human transition going on here. But notice how at the bottom, and obviously in the citation itself, it's not printed out like that. I've kind of done my almost word cloud thing going on here. One of the most important discoveries ever made in psychiatric therapy. So that's 1949, some 15 years after he's undertaken. We're almost in the modern era, we're in the post-Second World War era, and it's still being regarded in terms of the Nobel Committee as one of the most important discoveries ever made in psychiatric therapy. It was a risky procedure undertaking this, and you couldn't do that many at one time. It involved going in through the skull, and it was a risky operation. And it was one that couldn't be carried out on that many people. Walter Jackson Freeman II felt that he could do something about this. In 1936, having read reports of what Moniz did, he carried out his first lobotomy. And then he thought, well, this is taking too long. I'm going to modify the technique. And the way that he modified it was understanding that maybe what you could do is go in just there, just above the eye. That would give you immediate access. And if you got a sharp implement, like an ice pick or something like that, you could insert it just above the eye, and with a hammer go bang, 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 have a bit of a stir around, and you've effectively carried out a lobotomy under local anaesthetic or sedation in a fraction of the time that Moniz's Moniz's procedure was carried out. And he develops this technique, and from 1946 to 1967, he spends his life proselytizing for it. I think that it's very easy to see people like Henry Cotton and people like Walter Freeman, and later on people like Harry Bailey, as being exceptional, extraordinary figures, psychopaths, madmen. Because he does exactly the same thing as Cotton does. He gets his station wagon, he puts his kit in the back, and he travels from asylum to asylum, demonstrating his technique, showing how people could be given lobotomies, teaching people, spreading the word. He's a zealot for this process, and he does everything possible to try and spread the word. And indeed, the word does spread. He performs an enormous amount, over 2,500. But this is the technique that starts to be used increasingly within asylums. Freeman does indeed look something of a monster. We can see the implement that he originally used, and a description of the technique of the use of the hammer and the swivelling around. The very famous picture that's associated with Howard Dully. If you have time, it would be well worth going and looking up Howard Dully's story, because he's become something of a poster boy for the anti-lobotomy movement. Dully underwent the operation. It seemed that there was no good cause for him to have this operation. Like in many stories, it seemed to involve a dispute within the family, slightly out of order, teenage behaviour, nothing too extreme, and his parents were able to persuade Walter Freeman to carry out a lobotomy on Dully. And on the American PBS website, there is an audio download. You can listen to him talking about it. Because for Dully, it had virtually no effect. I mean, now, if you saw him, if he stood here talking to you, he would be a big bear of a man with a huge sense of humour. You wouldn't notice any diminishment in function. In his case, the lobotomy seemed to have very little effect at all, other than he underwent this radical and disturbing procedure. Whether that's because of the age he had it done, brain plasticity, or whether it was because lobotomy itself is such an unguided process. It's so hit and miss. It's not like they can identify exactly the area that they're destroying. They're just destroying an area within, it's scattershot. It's not directed. When neurostimulation is used today, it's very, very directed in terms of putting the electrodes into the brain. But this was, we'll just go in, have a stir around, and destroy the frontal cortex. So, like many instances, this does seem to have been a family issue. Here we can see Freeman's report to the Lancet in 1948. And again, I'm always struck by the way that, medical illustrations couldn't have been anything other. Suppose they could have used photographs, I don't know. But it's so anodyne. It's as if nothing is happening to the person. But at the same time, we can see the way that the implement is put up just above the eye, and in they go, and have a stir around. When the sweeps of the instrument have been made, it is withdrawn, and moderate pressure is maintained over the eyelids. And it's also worth having a look at the trainee physician's account of witnessing these procedures. As far as I remember, he probably did 15 or 20 on that particular day. Dr. Freeman did not leave the operating room after each procedure. The patient went out, the next patient was ready to come in, had his procedure done, went out again, and then the next patient came in. I remember that he was relaxed. He was very calm while he was operating. He made it look easy to do it. I think he had an extremely self-confident personality. How can a man be relaxed just going blindly into the brain? So it's you can see the almost industrial conveyor belt nature of this process. And of course, I'd be surprised if every one of you wasn't feeling some horror at thinking about that. It has to be remembered that Baumgartel's account is retrospective. And memory does funny things retrospectively. We don't really know if this was what he was feeling or whether this was the feeling he imposed upon it after the fact, after Freeman becomes like an evil poster boy for the evils of psychiatry. I don't know. I think, one of my students brought to me an edition of Australian Doctor that came out in 2011, and the whole edition was dedicated to 50 medical scandals. And I didn't have time to look through it to see whether this was one of the scandals. But what was striking about all of them, and those of you that have done body, mind and medicine will realise that every single one of those was in Australian Doctor, was the desire of medicine to boil it down to one or two rogue people, one or two rogue practitioners who were taking things too far, going too far. Freeman, you've gone too far with this. What we have to remember is that Freeman's technique was carried out in asylums across the world, and even in Australia. as we will see when Cunningham Dax came to Australia in the early 1950s. That's the Palace of the Brain on the Royal Parade. You'll notice that there's a cafe there called Dr. Dax, which is named after Cunningham Dax. Now, in many respects, Dax was a very humane practitioner. We'll see how he introduced occupational therapy, for example, into Victorian asylums. But he wasn't going to rule this particular practice out of the psychiatric armamentarium. He carried out transorbital lobotomies. It was a common procedure that was used in asylums across the world. So laying it at the door of one man really, I think, is almost a kind of dissembling tactic, a tactic to try and say, well, it wasn't the whole of psychiatry, but it was. And it was for a very good reason. In many respects, you couldn't actually fault Freeman's rationale for doing it. As we go back to the chimpanzees, or the change in personality of soldiers that have been shot through the head during the wartime, we see this reducing of the intensity of the emotions. By carrying out the lobotomies, the emotional nucleus of the psychosis is removed. The sting of the disorder is drawn. There is a bleaching of the affect, a bleaching of feeling, a bleaching of the emotions. And I think that you have to remember as well that the people that were suffering from the psychotic conditions that lobotomy was being used for were frequently disturbed by the intensity, the out-of-control nature of their own emotions, deeply disturbed by them. I've heard stories of patients even in the 1960s and their families demanding that psychiatrists use the technique of lobotomy. Demanding because they felt that it offered the potential to solve the problems. When your emotions are out of control, they can't be controlled. You're suffering from psychosis, hallucination. You want it stopped, and this can possibly do it. Even against the will of psychiatrists, patients and their families going, no, do it, do it, do it, do it. So again, this is adding a little bit of nuance to the story. It's very easy, like the Scientologists do, to lay the blame all at the door of psychiatry. It's much more effective to understand that those processes that we saw going on in the 19th century of families pushing for their loved ones to be placed in asylums, or families pushing for their loved ones to be released from the asylums, placing a lack of control over what the psychiatrists themselves can do, putting them under pressure to do what the families want. So again, it would be unreasonable. And the bleaching of affect to someone that has too much affect is actually a prospect to be sought, a prospect, a promise. Now, what we also see as well going on with lobotomy is a whole range of different rationale about why it works. Now, again, I have to ask you to, their knowledge of the brain is not our knowledge of the brain. It was that they had a very different understanding of localization networks and stuff like that. So they knew that this technique worked, but there are all sorts of theories about why it might work. So you get Judson Herrick's theory that cognition and emotion, joined by the combined action of the frontal lobes and the medial area of the thalamus, cut the nerve fibres to bleach affect. And we also see, that this kind of range of therapies that Pressman talks about, a spectrum of therapies, where he will claim that basically you come into the asylum They would do a whole range of sort of moderate treatments, hygienic treatments, group therapy, occupational therapy. But if you were intractable, you kind of moved up this ladder of treatment until when there seemed to be no options left, when there seemed to be only one last resort, which is why Pressman's book is called Last Resort. You go to this, to lobotomy. If Freeman is demonised, part of the reason that that demonisation is possible is because he seemed to be more indiscriminate about his use of it. But the fact is that, on the whole, I think even the surgeons themselves, the psychiatrists, could see how drastic a measure it could be. From the patient's perspective, as I've anticipated this slightly, there are mixed outcomes. Right? Some genuinely do seem to improve. Some appear not to be effective. Others have their personality drastically changed. Some even commit suicide. A whole range of outcomes. Some good, some bad, some indifferent. It's kind of like the story of psychiatry in a nutshell, really. And again, if you go to that PBS website and have a look at Dully's story, you'll find other stories. There was an old married couple there where the husband had insisted that his ultra-depressed wife go and get a lobotomy. And she was, in inverted commas, cured. They had lived, in inverted commas, happily ever after, following her lobotomy. So there are a range of different reactions. After the first time I taught this subject, one of my craziest students went up and stuck this all over the university. I don't know whether it was a good thing or a bad thing, but he was so moved by Walter Freeman's story and what he did, he felt that he had to make an artistic intervention, complete with an email address and what have you. So the wider impacts, the 1940s to 1960s, it's widely used throughout asylums. It's trumpeted by the media, and we see this in the award of the Nobel Prize to Moniz as a revolution in therapy. No, they made newsreels about this. If the TV had been done, there would have been TV programmes about it. There seem to be conflicting opinions about this. In the asylum, last resort, but when it's Freeman's own practice, it seems to have been a lot more indiscriminate. By 1951, over 18,000 patients in the US alone had undergone the treatment. But then we see it increasingly decline from the late 1950s onwards, when a whole range of antipsychotic drugs become available. They seem to have pretty much the same effect without destroying an area of the brain. Drugs that try to bleach effect. As we know, this is another story that we'll be talking about very shortly. A story that has a remarkable amount of symmetry with this particular one. We also know as well that it kind of becomes a symbol by the 1960s in things like Ken Kesey's One Flew Over the Cuckoo's Nest, this from the 1976 film. The book was published in 1962, which was seen as a direct critique of these kind of interventions. This is part of the wider revolt against psychiatric medicine, which we'll be dwelling on in some detail later on. There was very little professional resistance, even among the psychoanalysts. Resistance was meek, and people like Smith, Eli, Jellick were really quite keen on it. Often the defence would border upon what we regarded as the sophistic, and there were very few outright attacks. Very few indeed. So why did it happen? Well, it's easy to figure that out. particularly when we look at these kind of images taken from the appalling state of the American warehouses of the man in the mid-1940s, and what we know about the Australian asylums. The situation was pretty much the same there. They're overcrowded. Lobotomy provides a cheap, simple solution. They're not dealing with the intractable long-term conditions. Psychoanalysis didn't seem to be very good at actually dealing with the major psychoses. Psychoanalysis has become one of the major elements of dealing with mental illness within the American Psychiatric Association and beyond. And on top of that, we see the deeply ingrained biological tradition at work, one that we've seen time and time again. They think that it works, and they think that they've got a rationale for how it works. Remember, this section is still called speculation, desperation, and what have you. They think that it works up to a point. And this particular account that you can look at, and I'll try and make sure that the slides go up slightly quicker than they did last time. Sorry for Angela and others that have been wanting to get hold of them. They are up there now. And I'll let you read that stuff in your own time. So they think that it works up to a point.